Aspirin is a non-steroidal anti-inflammatory drug. Aspirin works as an analgesic because it blocks the production of prostaglandins in the cell that regulate pain and inflammation in the body. This causes the fatty acids that stimulate pain in the cell to be blocked from an enzyme called cyclooxygenase, and in return, the prostaglandins are not able to be synthesized.
So indications are angina pectoris, pain, fever. It's also used to lower the chance of heart attack, stroke. Aspirin is contraindicated in patients with any known allergies or hypersensitivity to NSAIDs. It's also contraindicated in patients with asthma, rhinitis, and nasal polyps. And also children that are recovering from viral illnesses should not take aspirin with or without a fever unless the doctor approves it, because aspirin has been known in children to increase the risk of developing Reyes syndrome, which is a serious brain and liver condition. Also, some other precautions: if you have a health condition that could increase your risk of bleeding or other complications such as clotting disorder or bleeding stomach ulcers, you're not going to want to take aspirin. That's because too much of an NSAID can cause stomach bleeding, and the risk increases in people who are over the age of 60 especially.
So the active ingredient in aspirin is acetylsalicylic acid, which is an NSAID drug. NSAID drugs block the COX-2 pathway, and so they're able to turn down the volume on our pain receptors because less prostaglandins are being produced in response to the injury.
Overall, aspirin is a very safe and effective drug when used properly. However, misuse and abuse with the dosage will result in harmful side effects and even possibly death. Now, for the average adult, you want to take 2 650 milligram tablets every 4 hours. And within a 24-hour period, you do not want to exceed 4,000 milligrams. When looking at your aspirin bottle, you want to check the dosage and the frequency on the back, as different manufacturers will use various strengths of the drug. This is also for if you're taking cold medications or stomach relievers. The active ingredient for majority of those is aspirin. So you want to make sure that you're not consuming too much of this product, as it can lead to an overdose. Lastly, a lot of the misuse will also be with consuming alcohol with this drug, as it can increase kidney damage or the risk of kidney damage or gastrointestinal bleeding.